This is Nicole Raleigh, web editor of pharmaphorum, and this morning I have with me Daniel Zakowski, CEO and co-founder of Ready Set Food. So, Daniel, you're going to be a guest speaker for our inaugural event, the World Without Disease Summit. But before we get into the whys and wherefores of your participation in that, I want to learn more about Ready Set Food. Obviously, I've done a little bit of research and I'm really intrigued by this concept because it is sort of a hot topic, I suppose you could call it. So tell me about the founding steps of Ready Set Food.
No, thank you. I think we're very excited to be here now, 6 years after those founding steps, and now helping to make food allergy prevention easy for families. 6 years ago when we started the company, my nephew developed food allergies. He was about 6.5 months old when they first detected his food allergies. I had a number of kids myself, my brother-in-law. He and I, he had read the clinical trials around food allergy prevention, and it had been a topic of conversation. And we knew we wanted to feed our babies allergens early and often to prevent food allergies, because that's what the clinical data was showing could prevent about 80% of food allergies. And my nephew especially had severe eczema, so he was actually at the highest risk for developing food allergies. But my nephew just wasn't very good at eating solid food at a very young age. So although the guidelines said to start really as early as possible, around 4 months of age, feed allergenic food to prevent food allergies, we waited until he was about 6.5 months old because he just wasn't ready to eat solid food very well before then. And by the time he was first eating solid food at 6.5 months of age, it was already too late. And he had already at that point, developed multiple severe food allergies. That's really what got us, thinking about, the data was really clear already that we could prevent most food allergies just by feeding small amounts of allergens, starting from a young age and doing it frequently. But it was clear, not just in my nephew's case, but also in the largest clinical trial to date at that point, the EAT trial, which was done in King's College in London. They had great results, but only in the 43% who were able to follow the study protocol. But that most of the babies had the same problem my nephew had, which is they just weren't very good at eating solid foods at an early enough age. And that for the babies that weren't able to eat enough, early enough, often enough, they didn't see any benefit of prevention. So, I think to us, it seems clear there was a huge opportunity where, just in the US, if every family could follow those study protocol, there'd be 250,000 fewer babies every year that get food allergies. It would be something that, parents would really find challenging given the compliance issues from the clinical trials and just our personal experience as parents.
So I suppose people at this point are thinking, so what exactly have you done, Daniel, to overcome this trouble with solid foods for infants of this age? So what is it that Ready Set Food permits that circumvents that?
Great question. So what we did is created a protein powder that dissolves in breast milk or formula that, mimics exactly the formulas that were used in clinical trials in terms of the amount of allergenic protein, the types of allergenic protein, but in a format that's much easier for parents to feed their baby, because whether you're doing breastfeeding or bottle feeding or formula or baby-led weaning or purees, at least in the US, the data showed that about 97% of parents were giving at least one bottle a day by the time the baby's 4 months of age. That's breast milk or formula or whatever it is. So that by putting basically a once a day small amount of peanut, egg, and milk powder in your baby's bottle, you're able to follow the exact protocol from the clinical trials that was shown to be effective at preventing 80% of food allergies, but in a format that's just very easy for every baby to eat because it's just in the food they're already eating, as opposed to a new taste, a new texture. Those are important things for babies to experience, but that, since babies have different reactions to those tastes and textures, important that no matter what their reaction is, that you feed them the appropriate amount of peanut and egg and milk to prevent food allergies.
So with these dietary guidelines by the USDA, what was the sort of situation before 2020 when these new guidelines came in? I mean, is this not now, but then novel thinking, or what changes were made that obviously gave you a springboard from which to work with?
There's already a lot of clinical data as early as 2014 and 2015 showing that you could prevent food allergies, and that's the data that the guidelines ended up being based on. So when we started the company in 2017, I'm not a doctor, but my brother-in-law is a doctor, and one of our good friends is an allergist, and the two of them could tell from all of the trials that were being published and in process that were seeming to show good results, that it seemed clear that there would be guidelines that every baby should eat allergens early and often. So I think we've definitely seen an acceleration in consumer interest and retail interest and payer and provider interest, once the guidelines came around. But that it was really clear as early as 2015 or so that early introduction worked. It would prevent most food allergies, and that would eventually be the medical guidelines for all babies.
It's great because if you look at, you're throwing out a lot of figures to me. So we could have 250,000 fewer cases if this sort of process is followed. But there's also the fact that every 100 seconds, a baby in America gets a food allergy. That's frightening. Is there a reason for this? Is this a sort of 20th century, 21st century result of differences in diet? What has caused this? Also, is it specifically US? Is it sort of worldwide?
Great question. It's definitely worldwide, especially in places, Europe, UK, Canada, Australia, America, see skyrocketing rates of food allergies. I'm more familiar with the US data, but the US data, depending on which food allergy you're looking at, a doubling or a tripling of the type of frequency of these different food allergies. And Australia, my understanding, actually has even a higher rate of increase, but that England and EU have very similar rates to the US, and even places like the eastern coast of China that are having diets that are more westernized are seeing also significantly increasing rates of food allergies. And there's definitely the causes are multifactorial, but that the biggest one that I think clearly makes sense when you think about what works for prevention is that as societies, we've started feeding babies solid food later and later in life. Again, I'm more familiar with the US data, but in the US, the average age of first feeding solids to infants in 1960 was around 2 months of age. Yeah, that was actually the average to feed solids as in general. And now the average age is something like 8 to 10 months of age, depending on which survey you're looking at. And
really?
No, look, and there's good reasons that we do it later. Babies could choke if you feed them solid food at such a young age. There's all sorts of good reasons why we've started feeding food later and later. But there's also been downsides that we didn't realize until it was too late, which is that by waiting to expose babies to these allergenic foods until they're older, their bodies aren't used to it being recognized as food, and their immune system reacts negatively. So it's important to introduce the allergens, but we still have an opportunity to mold their immune system towards tolerance. We in that sense, like a lot of what we've done is great by feeding solid food later, but we have to kind of go back to the olden way of feeding at least the allergenic foods earlier and more often.
Definitely. So early allergen introduction for prevention. And on the topic of prevention, let's sort of segue now to your participation in World Without Disease Summit. So the ethos of WWD is delivering future health through disease interception. And it's quite clear that what you're doing is intercepting any worsening of the situation of skyrocketing cases of food allergies. So tell me a bit about your presentation that you're going to be making, Daniel. It's called Preventing Childhood Food Allergies, which is sort of a no-brainer why you've called it that. But can you tell me a bit more, maybe give us a snippet of what's to come in June?
Sure. I think that there's a couple different components. Number one is that, while people who are really closely following the allergy science, it's clear to them that every baby should be eating allergens early and often. And there's such a huge public health opportunity. Like I mentioned, just in the US alone, 250,000 babies a year, at least we can prevent from getting food allergies. One thing we need to do is just help spread more awareness of that opportunity, globally. There are medical guidelines in the EU and in England, in Canada and Australia that all recommend early allergen introduction. But really working as a global health community, this is, again, like you mentioned, it's not just an American thing or not just an English thing. This is a global problem that stems from some of the same issues and has some of the same resolution. And instead of thinking about this as a US only problem, I think there's an opportunity to both make sure that we're all operating from the same base of awareness on science and data. And then also talk about some of what we're doing in the US as Ready Set Food to work on implementation, because as we mentioned, one of the big issues is not just around education, it's around how do you actually implement the recommendations to get a good outcome. That's why even the clinical trial, they had compliance issues. There was no lack of awareness or education problem in the trial that had only 43% compliance, difficulties with implementation. So I think the two things that we really wanted to focus on is kind of sharing awareness of where we see kind of the current state of the science and the guidelines and the future of food allergy prevention, and then an important component of that's not just education, but also how you actually get that done and help parents implement that at home. Our product, but there's also a suite of tools with education and other ways you can help make sure that every parent has a really easy opportunity to give their baby the best chance of not developing food allergies. So yeah, I think that's really what we want to do, is just explain how we've worked, through education, through implementation, and in partnership with healthcare providers and with payers, to really start a comprehensive strategy for ending the food allergy epidemic.
Absolutely. I think you've summed it up. Ending the food allergy epidemic, which it veritably is. So that was a fascinating conversation, Daniel. Thank you for your time. Is there anything else you want listeners to sort of take away? Or
no, I think we're very, very excited to talk to more public health professionals around the world about the enormous opportunity in preventing food allergies. And I think that the reason that we find it so exciting is not just the depth of opportunity that there is in preventing all these babies from getting food allergies, but also the relative simplicity of solution. There's all sorts of other chronic issues that also require attention, whether it's diabetes or obesity. Solutions are quite challenging and complicated, and there's still a lot of more research that we need to do. Whereas getting babies to eat allergenic food the way we used to in the 60s is a much more simple answer that can impact so many people's lives through a much more easy to solve or easy to address issue.
Definitely. Well, thank you for your time, Daniel, and I look forward to hearing more in June. And so that concludes this episode of the Mini pharmaphorum podcast. You can find more information about this episode, including a download link and information about previous installments and the main pharmaphorum podcast series at pharmaphorum.com/podcasts. The Mini pharmaphorum podcast is also available on iTunes, Spotify, Acast, Stitcher, and Podbean, where you can find and subscribe by searching for pharmaphorum. Of course, don't forget to visit our website, where you can sign up for daily news and analysis bulletins as well, and follow us on Twitter at pharmaphorum. Well, that's all for now. Thank you for listening.